So today I'm at Moorfields in Healthcare City, and I want to introduce you to this very talented person sitting right next to me. This is Dr. Alia Issa, and say hi.
Hello.
So Dr. Alia she's treating me for my eye dryness sort of irritation issue, which is, a lot of people ask me about that, and now I'm having IPL, and we're going to show you that later for my eyes. But also Dr. Alia has a special skill set. So tell us a bit about what your role, your job, basically. It's kind of a stupid question, but you don't know. She's a doctor, but not a normal doctor.
Not a normal doctor.
Explain that before I make myself.
Thank you very much, first of all, for taking the time
and
the interest. Basically,
yes.
It's an honor, really. So I'm an ophthalmologist, which is an eye doctor, right? And as part of ophthalmology, there is a tiny subspecialization, which is called oculoplastics, which is basically the plastic surgery of eyes.
Eyes, so
yes.
Oculoplastics.
Yes.
Oculo as in O-C-U-L-O. Okay, so of the eye.
Exactly.
Right. You're not a plastic surgeon of anything else?
No. I just focus basically really on this area between the brows to the mid-face.
Okay, so...
and the eyelids, obviously.
And the eyelids. So what's in your, what's the most common stuff you do in terms of
So because I'm specialized in aesthetic oculoplastics.
Yes, specializing in aesthetic oculoplastics. That's very unusual because there's only one fellowship. I mean, it's a fellowship.
Yeah, it's a fellowship, and it's a very specialized fellowship. So basically, there's oculoplastic, which deals with everything around the eye, basically. No? So which could be the orbit, which is where the eyeball sits in, the lacrimal system, for the tearing and all those kind of things, and also the eyelids. But in aesthetic oculoplastic, I focus more on rejuvenating the eyelid area.
Making it look pretty and youthful.
Well, yes.
Yeah, that's what it is.
Yes, that's what it is.
Because I always say that the eyes are the first place on your face to age, or the first part to age. You really see it in the eyes. But yeah, okay. So doing the aesthetic, how did you train? So you had to do the normal ophthalmology training, which is 7 years.
Well, in the UK, it's 7 years. In Germany, it's 5. But
it's okay.
Still.
5, 7. You did most of your training in Germany?
Yes. So I did med school in Germany and also ophthalmology training in Germany. And I was always interested in the, plastic part. And I was also a little bit interested in dermatology. And right. And the eyelid skin is very, very sensitive and very specific. And you know this as a dermatologist, treating the eye area is very different from the rest of the skin, because the skin is just much thinner, more delicate. And of course, as an ophthalmologist, I also see the function behind it. So on one hand, everybody wants to be super lifted, right? But as an ophthalmologist, I still, want to make sure that the function is preserved, because
eye closes.
Exactly, that the eye closes, that it opens, that the eyelids sit where they're supposed to. Otherwise, you get problems like dry eyes and, even vision problems, right? So what I did then was in the UK, I did an aesthetic oculoplastic fellowship in London, which is one of a kind. And so there I trained really specifically in aesthetic oculoplastic, which eyelids lift, brow lifts, mid-face lifts.
Okay. Can you do that anywhere else? Because I've never heard of that fellowship before.
Yeah. So no, not really. So I think in the UK it's the only one, and also in Europe you won't find a specific fellowship like this. And I come from Germany, where fellowships in general aren't really so much of a thing, right? So it's basically you find what you like, but like a real fellowship program was something I wanted. And then I was very lucky to find that in London, and trained with Professor Ezra, who's one of the most well-known.
I think probably in the UK definitely, but whether or not it's global, probably.
Well, I mean, he does have some international patients for sure, right? And I think maybe there's 1 or 2 aesthetic oculoplastic fellowships in the States now, because their training is a little bit different. So they also do oculofacial plastic surgery, as a specialization. But in Europe, it's.
So that I mean, we're talking 2 doctors a year perhaps go through that fellowship, or not even?
Yes.
Yeah, I mean, that's 2 doctors a year. So that's like very few. So you did your ophthalmology training, then you did oculoplastic subspecialty training?
Yeah, so
Yes. And how
I
long
did,
does that take?
well, with the oculoplastic training, like I told you in Germany, it's a little bit different. So you just do oculoplastics. It's not a fellowship program like you have in the UK. And then I went straight into aesthetic oculoplastics.
I mean, that took you how many years?
A few.
I don't
even want to count.
Yeah, don't
anymore.
count the years. Don't count the years. Dr. Alia has a very specific and special area of expertise, and that is aesthetics of the eye. But it's not just like under eye filler. You're talking about all the different procedures that can make the eye look rejuvenated, more youthful, and more beautiful, basically. Yeah. So that's that, and that is if you're gonna have someone mess around with your eyes, like in an anti-aging type of rejuvenation way, you want someone with this type of training. It is your eye, after all. And I kind of think an ophthalmologist, as an ophthalmologist too, the function of the eye is important, which I think may be lacking in perhaps other areas that people do. Other people who do the same type of surgery, but but nowhere near as precisely with the same type of training. Because you don't get that training with ENT, you don't get that with maxillofacial, you don't get that with general plastic surgery.
No, probably not. I mean, there's a lot of plastic surgeons who are obviously doing also blepharoplasties, and they do a wonderful job, for sure. There are a lot of really, really good plastic surgeons out there. But for me as an ophthalmologist, for me the function comes first. Yeah. So sometimes the patients come in and be like, oh, I want this, exactly that. And the problem is, you can't lift so much that you lose the function of the eye, because for me that's the most important thing, right? That the eye still closes, because otherwise you might get really bad problems with dryness and having to deal with those problems. And I do see patients with complications after this kind of surgery where they really suffer from that. So that's something that's very important for me to preserve, right? And
I think for the patient too.
For the patients too. No, and obviously, when the patients come to me for a blepharoplasty or any kind of treatment around the eye, I actually look at the eye as well, right? I make sure that the ocular surface is fine and can handle any kind of surgery, that the conjunctiva is good, that the cornea is good, to basically also give me an idea, okay, what to expect, and for the patient to know what to expect. Because if I see a patient with severely dry eyes, I would be like, okay, well, maybe we should treat that first before we do any kind of treatments that could make your symptoms worse. No? So I think that's a really important thing when you do any kind of procedure around the eyes, right?
That's partially why I always have said if I'm going to get my eyelids done, I'll definitely go to an oculoplastic ophthalmologist, because I care about my vision. And my eyeball health. And I always say to patients, like, if you're in Moorfields or similar and you're with an oculoplastic surgeon, if a problem happens, not that problems happen, but let's just say.
I mean, they can.
Yeah, they can happen. You're in the right place.
Yeah.
You're surrounded by other ophthalmologists
to take care of
you, so help you. So, I mean, I think the important thing to know about this is that Dr. Alia has this very specific training that most other oculoplastic surgeons or ophthalmologists don't have. And you're definitely the only one in Dubai, at least as far as I'm aware. And I like to know what's happening with oculoplastics because it's an important specialty for me, for my patients. So, no, I think that's fantastic. So what is the most commonly kind of requested, or what's the most common issue you see when it comes to aesthetic oculoplastics?
Well, I think the number one is still a blepharoplasty.
Like upper?
Right? Yes, upper blepharoplasty, because, as we age, our skin gets a little bit more saggy, we do get some excess skin, and sometimes it can even affect the vision. Right? So when you have a lot of, upper eyelid skin and even the droop of the brow, it can affect your peripheral vision, especially as we age. It sometimes even happens a little bit earlier. Some people just have naturally more hooded eyes. But that's definitely the most requested procedure.
And do you do things like brow lifts as well? Or do you sometimes correct it with the brow lift?
Yes. I very often actually combine a blepharoplasty with a brow lift, because I think, a lot of patients come in and it's like, oh, I have all this sagging skin there, right? But what they don't realize is that it's not only the skin, it's also the brow that has drooped over time. And, you can correct it a little bit with some Botox and so on, just to give it a little bit of a lift, but
it's challenging.
And you often end up with an unnatural look. So what I like to do then is to reset the brow, right? The non-invasive treatments like Botox, or I'm not a fan of filler around the eyebrow area at all.
No,
I don't know what
I've
you
never
think
done
about that.
To the brow area?
Yeah. There
not.
are some dermatologists or surgeons who will actually say, "Oh, we'll give you a lift of the brow
with
filler."
But where do you put it?
Yeah, here, and then
just under the brow,
and then they're like, "Oh, you have you get an illusion of a lifted brow," which is, in my opinion, not the right approach.
Yeah,
for it.
don't
I
do
don't know
that.
what you think about that.
Yeah, no, that sounds terrible. I've never even heard of people doing that.
I mean, you see that, or you see patients even having like filler here. I'm sure you have seen patients who had that done before.
I think so, but that sounds awesome. This is such a dangerous area.
It's a dangerous area, and I do see very many complications with that. So I try to avoid that as much as possible.
Yeah, avoid that. Avoid everyone. So if your doctor suggests that, run away. Yeah,
definitely. So I do like to combine, in cases where it's appropriate, to combine the brow lift with the upper blepharoplasty. And I explain it to the patients. Now, you can get a nice, lifting by just removing the skin, but I always explain, well, it's not going to change the position of your brow. And if we want to, especially, when you get this droop here on the side, like some patients, they get this droop, and you see this line here, right? Yeah. And this is most often really the brow that has drooped over time. Okay. And a brow lift can really add up to, the more open and awake look there.
And how do you do the brow lift?
So there are different ways of approaching it, right? So in patients who are a little bit more advanced in age, I actually prefer the direct.
What does that mean? What's advanced in age?
Advanced in age. Well, look, I always, we have to think about scarring and the skin type and so on. And I think at the age of around 50, it's quite safe to do a direct brow lift. But I do a modified one that I've learned from my mentor, basically, in the UK, which can give you a really nice brow lift, which is a strong lift. It's, in my opinion, the strongest lift you can get in that area. Just here on the tail of the brow, which will really open up this area, combined with the blepharoplasty.
So you make an incision
just above the hairline, and then it's hidden. So you basically, after a couple of weeks, you don't really see this so much. But it's not appropriate for every patient, right? So if they don't have any eyebrows, it's probably not the right choice. Or if they have really dark skin, they're more prone to scar badly. But that's a really nice procedure to combine with an upper blepharoplasty. And the other option is from the hairline.
Yeah.
Now, I always tell, this is most of the time a little bit younger patients who do have, a lot of hair still in this area, and they don't want a scar in the face because they're scared of it. And also, younger people, sometimes the scarring is a little bit more unpredictable, but the lift is not as strong. And I always explain that to my patients. You get a nice lift. It's sometimes not as long lasting.
Yeah, I was going to say, what's the average? You're talking about endoscopic brow lift.
So yes, with the endoscopic. So I mean, set the expectations at around 4 to 5 years for the brow.
That's better than I've seen it sometimes. So, I was looking at threads.
Oh, threads? No, I would never do threads.
Yeah, I would never do threads.
I don't, I know they're still around a lot, but,
weirdly.
Yes, it's like, even I was at a course and they were talking about threads all the time. I was like, who does this?
Yeah, who does this? And same with the lower face, like who does threads now? We have better ways of doing this, like surgery.
Yeah,
so no threads in the forehead,
no threads,
guys. None of that
threads,
please.
No brow lift
with
the threads or anything like that.
Definitely not.
If ever, it gives you like a lift of maybe 2-3 months, and then you get problems.
And it's like 2 millimeters. Yeah. Because I've read all those videos. I'm like, 2 millimeters. That's like. Can you even tell if there was a lift?
But a lot of patients are scared of surgery, right? So they prefer to do other things to delay it for some time. But in some situations, I mean, sometimes you have to discuss those things with the patients. It's like, what can you realistically achieve with non-invasive procedures, and what can you achieve with surgery? And sometimes, the patients are just looking for very minimal thing, or a mild brow lift. I mean, I sometimes also do something called a browpexy, which is basically when I do the blepharoplasty, and it's a lift from inside, right? So basically refixating the brow from the inside with
through this incision,
and then going to the brow and lifting it. But this is also a very temporal lift. So the browpexy is something that can give you like a nice. Also, not much more than 2-3 millimeters, but it can open it up a bit for those who are just looking for a tiny bit of a lift. But I always, warn the patient, it will not last as long as a direct brow lift or an endoscopic brow lift.
And you do under eye, like when the people have bags, you can fix the bags.
Yeah, so with eye bags, as you know, they are a tricky area to treat. So when it's eye bags, like really fat prolapse, then the blepharoplasty, the lower blepharoplasty is the best option, because you need to from the inside. There are two ways of doing it. Now, when you have a patient who has a lot of excess skin and really big bags and is also in their 50s, sometimes it's the better approach to do it from the outside, so that you can reposition it nicely and also do a mid-face lift with it.
Bonus.
Exactly, but longer recovery time, right? So this is what I warn the patients about. Okay, so if we do this, it's a more extensive surgery. The recovery time is a little bit longer. The swelling and the bruising might be a little bit more. And then there's the other more elegant way, which is basically doing it from the inside of the eyelid. It sounds scary.
Sounds terrible. Because the patient's awake, right?
No, not really. So, I mean, you can
put
do
me
it.
out for that, yeah.
Yeah, so usually I do my surgeries under sedation. It's just more comfortable for the patient and, for everybody around. They just snooze off and then they wake up once it's done. It's not a general anesthesia, so the recovery is much easier.
Quicker.
But you can also do it under local anesthesia if the patient prefers that.
And just clamp their eye open. Do you have to clamp the eye?
No.
Like, it's not like the dentist where they like,
I mean, I have to flip the eyelid.
Oh, right. Oh, I hate when you guys do that to my upper lid to look for something. Don't know what you're looking for when you flip the lids.
Well,
what are you looking for when you flip the lids?
Well, we look at the conjunctiva mainly, or foreign body, or
Okay.
allergies and things
See how
like
much I know
that.
about this. So if someone, so you can reposition that fat pad to make it more of a smooth contour.
Yeah, so you can do this from the inside or from the outside. But if you want to lift the skin a little bit more, then an external blepharoplasty might sometimes be the better option. In some situations also, when they don't have that much excess skin, but a little bit, I would send them after the blepharoplasty to you to do a CO2 laser on top.
Yeah, I can do that.
Because that's actually quite a nice thing, right? Like, what do you think about CO2
I love
lasers?
CO2. I use it a lot for under the eye.
Yeah.
And a little bit on the brow bone. But it does have that mild tightening effect, just as CO2 does. And it does help with the fine lines a lot. So I have a lot of patients who really love that treatment.
Yeah, no, I do think that CO2 laser definitely has a place. And it's a really nice procedure to combine with an internal blepharoplasty, just to tighten the skin up a little bit and treat those really tricky to treat fine lines that you get when you smile.
Yeah, everyone complains about the right here, the little lines.
Exactly.
I'm like, you can't treat though. You can't put. Well, I've seen people put Botox here, but I don't think that really helps anything.
Because you also just need to use a tiny bit, and then it doesn't
really do it. I don't know what we're trying to do with that. Or I've seen people put Botox just in the corner of the eye here, like on the lower lid.
Yeah, well,
I don't know what that would do.
I do Botox on the eyelid sometimes for blepharospasm, mainly, that's different.
Yeah.
But it does smoothen the lines also a little bit.
But directly under the eyes, that's always something people ask me about. And I'm like, well, I would do CO2 for that.
Yeah.
To see if it would help. But you are doing stuff for dark under eye circles.
Yes.
Right. So this is a huge topic.
It is.
I mean, I wrote in my book, I wrote 2022, so it's 3 years ago. I wrote that there are no treatments for dark under eye circles. And I went through the whole, explaining why people have them, blah, blah. And then I said at the end, so sorry, there's nothing you can do. I mean, it was the worst chapter ever, really. So, but what do you, because you're doing some new stuff that I have not come across.
Yeah, I mean, look, so dark circles, the most important thing is always to find out, okay, why does the patient have dark circles, right? So is it real pigmentation?
Yeah.
No, is it hereditary? Is it because of their ethnicity? Is that the reason why they have dark circles? Do they have dark circles because the skin is really thin, right? And the vessels, vasculature is shining through?
Yeah.
Or do they have dark circles because of shadows? Right, so when
the shadow one's easier.
The shadow one is easier because then you do a blepharoplasty because it's because of the back, and that's why you have that. No? Pigmented skin is difficult to treat, right?
Well, see, I love it if there's pigment. I'm great at treating pigmentation. So if there's pigment there, I'm always like, yes, let's see if there is any. Use the cream around your eyes.
Yeah, very good.
And so sometimes it can help.
Yeah, so that's what I tell my patients too. Like with the pigmentation, it's something like. The treatments that we do, they can brighten it up a little bit, but at the end of the day, you have to do your skincare because there's a lot you can do with skincare lightening. And when the skin is really thin, those are the ones that you can treat. I don't know what's your take on skin boosters.
I have done that around the
Yeah.
eyes, and I do think it helps maybe a little bit, but it's not. I know you do it, but you don't do skin with your little that special type of cannula.
Yeah, so I do it with a cannula most of the
flexing.
time, but I also use the needle in some situations. I often combine it together. Now, my take on skin boosters is, I do think that it improves the quality of the skin there. And when you have a little bit thicker skin, the vessels just don't shine through so much. But, a lot of treatment of dark circles also depends on the patients, because we all know our dark circles are worse if we, are dehydrated, if we didn't sleep well, all those kind of things that nobody wants to hear. But it's true.
It's your fault. That's what you came here for.
Yeah.
For me to tell you it's your fault. Yeah. So, but you're getting good results from using, what do you use?
Yeah, so I do use, it's quite modern thing, and it's, the research is still underway, I would say, but I do see, at least in the short term, now that I've been using it, good improvements with polynucleotides.
Yeah. But special ones.
Only the ones.
Only the special ones, not just any polynucleotide that you can get at like a beauty salon.
No,
and get it microneedled in.
No, I don't do it with the microneedle. I really inject it
with the cannula.
With a cannula and with also some with a needle on the sides, depending on where it is. But I'm getting nice results with it. It improves. I do think it improves the skin quality. I also use PRP and PRP gel mainly. And interesting thing I found there is that I find it improves especially the dark circles and the thinness of the skin in patients who had previous filler treatments.
Oh,
which is interesting.
Yeah, that's interesting.
Yeah, because I do think it might have. So this is something I'm working on and researching and seeing if it really has. But I do think it kind of improves a little bit, the lymphatic system as well, maybe. So because I saw in patients that, after the filler and they had those kind of swellings recurrent, that they had less swellings very often, like less malar edemas. But this is something, maybe we don't include that, but we have to. But it's just a personal observation that I find in those patients that it helps a lot.
Amazing. No, that's, so the dark circle thing is an ongoing kind of area of research and and people like Dr. Alia, she's the one who does that type of research. It's not me. So
no, but I'm sure, as dermatologist, the skin is really.
Just tell me what to do. I'll do it.
But so what's your favorite treatment for
dark circles? Managing expectations.
That's a good one.
That's a good one. Yeah. And I use the same types of treatments I use for melasma or hyperpigmentation of the face. I would basically just tell the patient to put the same cream under the eyes, usually with a bit of like something like Vaseline or similar on first, then put the cream on. And then if they do get lightening of that area, then I'm like, yes, great. But it's not going to ever turn exactly the same skin color, So
so you use active ingredients.
I use hydroquinone basically with a combination. And that works nicely for certain people. But I can't guarantee it. I always say there's not really anything we should do. But that's obviously depressing for patients and for me to have to say. So I love the idea of kind of using new things in that area. And when I feel like I think that it's been doing well for a while and it just does no harm. I don't think it does. It doesn't harm you to have like polynucleotides, the right type of polynucleotides, or PRP or whatever it is, injected into that area. It's not going to be harmful unless they don't know what they're doing.
Yeah, I mean, as long as you inject it into the right
the right place, in the right plane.
But I mean, it's, what you said is so important, managing expectations, and this is why the consultation is so important. Sometimes, and I'm sure you get messages from patient. It's like, oh, I want to do this and this and that.
Yes, right? Just book me in,
and I want this treatment. And it's like, okay, well, I first need to assess you properly and see if you are right candidate for this procedure, right? I mean, even in your friend group, sometimes you would say, it's like, oh, I saw this and this is what I want. I think in the times of social media nowadays, it's so hard, right? Because everybody knows everything. Everybody knows everything better. And then there's ChatGPT on top, right?
Everyone thinks they're a doctor and knows better.
So it's really hard.
Maybe leave it to the experts, guys. I'm not going to go be someone's accountant because I don't know anything about that. And ChatGPT is not going to teach me how to be an accountant or a lawyer or something. So don't DIY it. Just let us decide what's best for you or whatever problem it is. So yeah, I get people message me and saying, I would like to book in for a CO2 next week. I'm like, yeah, I've never seen you before, so let's not waste an hour and a half of my time booking a slot for you when maybe you can't have it.
Yeah, exactly.
So I'm like, no, come in for a consult, then think about it. But no, so that's a lot of good topics. Is there anything you want to talk about? Cover the topics I had in my head.
Well, so if we're about aesthetic oculoplastics, I think that's the most important things, right? That we take care of the eyeball that's behind there, the function, right? And that we really take into consideration that we need a proper consultation first. And, with all kind of aesthetic procedures, you need to be comfortable also with the doctor that's doing the procedure for you, right? So I think, but it's also really important that you build some trust in that sense. 100%. So I try not to, and I hope no patient ever feels rushed into anything. So take your time, think about it. It's always going to be here. It's always I'm not going to run away. It's not going to run away. Dubai is such a fast-paced place, right? Sometimes I come in and it's like, I want it now, like today. It's, okay. Take your time. Maybe not. Yeah, and we're like, no, sorry, come back. But we're meant to really, in the GMC guidance anyway, we're meant to give patients a cooling off period for any aesthetic type treatment. Yeah. So that is part of the guidance that you follow, I follow. So maybe not 2 weeks, but like at least some time. No, and that's really good. And it's also something that I, during my fellowship that I learned, it's like, okay, the patients, they come in and they know what they want kind of, and you have this conversation about the procedure and they're like, okay, good, but we're going to have another conversation. In 2 weeks. In 2 weeks, or whenever it is, right? Just so you have a little bit of cooling off period and that you gather your thoughts and can ask all your questions, and then we can talk more about specifics of the surgery and risks and so on, because every surgery, and this is important, even though we hope that never anything goes wrong, but we have to talk about every kind of possibilities. It's important, we can manage every kind of risks, right? But we have to talk about that. You need to be consented correctly and know what you're signing and know what you're agreeing to. So, and this is all part of the consent process anyway. Yes. So understanding what you're having done and thinking about it and so on, coming back with questions. Yeah. So that's, especially if you're doing something on the face and something that's more permanent, like a blepharoplasty, as opposed to like a bit of Botox. So that's not permanent. But so, for me, the message I want to send to everyone is that there are super specialists who do these types of procedures. So if you're going to think about having anything done to your eyes from an aesthetic perspective, I would always say, find the most specialized person within that field and see them. And that's what Dr. Alia is here in Dubai. So if you want something aesthetic done to your eyes, you know where to find her. So I'll tag and everything. And that's definitely the way you should go, because hopefully, your function of your eye is going to be taken care of as well as the aesthetic appearance. So, all right, cool. Good. Thanks so much for taking the time. Thank you so much. Thank you.